I think it's safe to say that most companies at this point have dabbled in AI one way or another. Maybe rogue employees using ChatGPT, but most of them are finding that to actually have great results from AI, they need more custom-built solutions. You gotta fine-tune each of these models to actually give you the output that you're looking for. That's a pretty complex thing to do though, and with that complexity comes an opportunity for solution providers to step in and help their clients realize the potential behind AI. That's why I'm here in Southern California to find out about Data 41, who in collaboration with Ingram Micro is developing custom AI solutions to drive better patient outcomes for therapists. Let's go inside. Before we get to Data 41 though, let's take a quick look at the problem that they're faced with solving. McKinley is a mental health services organization based in Southern California that was started over a century ago.
We were founded in 1900 really as a place for children to live in if their parents were unable to take care of them for whatever reason. We now work with children that have experienced some significant trauma in their lives. Our goal with the children we work with is to help them through that because we believe everybody can heal from trauma. We've been growing, it's exciting, but the purpose of McKinley really is to work with communities, work with individuals and families to help put them on a path towards healing.
This mission has helped propel them over the last 125 years as they provide mental health services to people like Andy.
I was put in the system, I think it was 7 or 8. I've been into 9 different foster homes and I've been through a lot of different therapy, and it was very hard for me growing up because I didn't have a support system. I was moving every 3 to 4 years and I always felt alone. McKinley, working with the therapist was really important for me, especially for my life, because it changed me as a person and kept on making me have hope every single day. They really need everything they can because they are really great and changing one life at a time.
While there's a myriad of problems that mental health counselors and therapists face, one of the most common ones is a familiar one. Too much admin and too much paperwork.
They're working in high trauma environments. So they're working with individuals in some very difficult points of their lives, very stressful points of their lives. Their schedules are always changing. So regularly they may come to the office expecting to have a very defined caseload, and then all of a sudden something comes up and they're reacting. On top of that, we're finding that there's really more and more administrative burden for them, especially as they're working in more intense settings. It's pulling them out of what they went to school to do. They really wanted to work with the individuals, the youth, the families that we serve. And when they're kind of pulled out of their schedule, they're adjusting, and then on top of that, they're really having to do all of this admin work. We're finding that it can lead to burnout, it can lead to stressors, and it really then impacts the quality of care.
I think all of us can think of a teacher that we had in the past that was particularly impactful for us. And if you think about why that person was so impactful in your life, they gave you what was most precious to them, which is time. No one ever looks back at that person and says, well, they were really good at paperwork, right? It's the time that they gave you, and that's what we're trying to create here. And we believe artificial intelligence can help us with that.
The threat of burnout is real, and it seems like the messaging behind AI is poised to be able to tackle this problem head on. But like any healthcare organization, McKinley faces some specific problems that keeps them from using a more public model. 1, McKinley client data is sensitive, needing a secure and compliant storage solution. And 2, in order to ingest the required data, McKinley needs a few different AI technologies working together in order for any solution to be useful and consistent across the board. Which brings us back to Data 41, a VAR with an extensive data analytics background, and they were ready to take on this challenge.
When we were introduced to McKinley, it was about 10 years ago. They actually had an advanced analytics project that they were trying to conduct, very forward-thinking of the executive staff over there. How do we use technology to create the outcomes for what our objectives are, and their objectives are to help children? Because each one of the foster kids were coming out with a unique set of circumstances that brought them there to begin with. But if you look at how humans kind of process information, there are certain categories that are standardized. And whether it's visual, whether it's kinesthetic, whether it's auditory, Most people process information kind of the same way or a combination of, and they're using statistical modeling to help them understand the kids that they had there and the best way that they could help them learn and help them, through their programs. There's a lot that goes into a Gen AI type of project, but the prompt engineering that goes into making a Gen AI solution work for an organization is where the magic happens. What is compiled in these documents? How many documents on average are put together in an electronic health record? What is an extreme case? What is a minimal case? So then we could go in and focus on key aspects of those forms, so the summarization would come back. Number one, it'd be accurate. Number two, the clinicians would believe in it, right? It's truthful. And then to push the envelope a little bit, and we're not quite there yet, is that once you get that first phase built in, then they have a treatment plan that they want to have developed from that. And that's the next step.
With these challenges came the need for specialized training, something that their distributor, Ingram Micro, was able to assist with.
You want to be able to ensure that the quality of solution and product that you're providing your clients is going to match their expectation. Especially with McKinley, the outcome is very, very important. So it allowed us to hire our first senior AI engineer, and his first day on the job happened to be at an Ingram Micro workshop for Gen AI certification, level 3 certification. So he spent an entire week in Chicago, day one traveling out there, and then I think 4 days on the ground getting his certs on that particular technology. But we had to accelerate the process, and this is where the relationship with Ingram really came into play. Okay, great. Ingram, help us leverage your contacts to help him learn this stuff faster with real world use cases. But it's that relationship that we have with Ingram and in their relationship with vendors that's very broad, that allows us access to multiple vendors, that allows us access to very specific resources that they can leverage that sometimes we actually can't get a hold of.
It's still early days for the technology, but the results that McKinley therapists are seeing are really positive.
What has been your feedback, I guess, from everybody now?
A clinician that's burnt out, a clinician that's tired, a client picks up on that immediately in session. And to have clinicians that are energized because they don't feel like, oh, I'm going to have to do all this documentation later. They're really able to attend in those sessions, and it improves our outcomes, it improves client satisfaction, and ultimately it's helping improve our ability to maintain our clinicians so we don't lose them to other areas of the field.
It's no secret in our field that there's a lot of paperwork that they have to do, a lot of it. It's something that everybody talks about and everybody understands it's important. They have to do it, but it takes a lot of time. So what we're really hoping is that this compresses some of that time so that they're more available. We believe people get better because others are spending time with them, they're investing their time with them, they truly care about them. And when there's more investment with the children and the families we work with and the adults, the outcomes just get better.
At the end of the day, McKinley's goal in using this technology is pretty simple. Put more time back in their therapist's hands so that the quality time that they're spending with their patients is just that, quality. Anil shared a story with me about how salespeople only spend about 35% of their time doing sales, and the rest of the time is just doing paperwork. I relate to that. How much of my day is spent doing emails instead of the actual work? Well, in the case of McKinley therapists, that work has a tremendous impact.
They got to know me first, which I think was really helpful because I would have never talked if it wasn't for them to just play a simple Uno game with me or Macala or even color, and it was more of like, we listen to you and we're gonna get through that and we're gonna have fun while healing through that.
I hope you enjoyed watching this as much as I did making it. It's really great to do a story about how generative AI is having a real positive impact in the world right now. If you want to learn more about Ingram Micro or catch more CRNtv content, please check out the description, subscribe to our channel, and I'll see you next time.